Okay, so I am a cancer exercise specialist, and that's what I've been doing for about the last 10 years. But my background is nursing. So I began as an oncology nurse at the Marsden. I did my degree there. I worked in acute care for a long time, and then I moved across to UCH, and I was part of the specialist palliative care team there. So I've got a very long history in the world of oncology, dating about 25 years now. And thankfully, with regards to exercise, there's more and more data coming out and more evidence to support the fact that we all need to move just that little bit more and more often. So my mantra tends to be move more, but move more often. And it doesn't matter kind of what you do. What is really important here is sometimes exercise for people, they think, oh, gyms, expense, horrible gear that you have to buy, feeling very uncomfortable in certain situations, and that's not it. Okay, it can be as simple as going out for a good walk every day. Yes, if you want to go to gyms, brilliant, that's fine, but it is not essential. Thanks to technology, which I'm slightly against at times, there's so much available online now as well. You can just download things off, you know, go to YouTube, and there's tons of things that you can follow there. You've got to sift out certain things, but find something you like, find somebody you like, and just do a little workout every day. So there's lots of opportunities now, and I'll go through various little things that we can do along the way. So the aim of the session, I'm going to get you to move a little bit more later, but we're going to just basically go through an overview of the benefits, which I'm sure most of you know. I mean, it's everywhere these days, what we need to do for our bodies as a whole. The physical and psychosocial well-being, and I will do a little bit of look at the research and evidence, but I'm not going to overwhelm you with that because you can go home and look at that. Just to say, there's over 13,000 published articles on the benefits of cancer and exercise. There's a lot of stuff out there. So lots and lots of more and more data is coming out every single year, and there's some very exciting trials going on at the moment, and probably in the next 10 years we're going to see some more evidence, some new data coming out. Right, so for me, exercise is medicine. Absolutely. It's as important as any other treatment, as any other intervention and modality. Australia at the moment, they have just put out a statement that came out last year in terms of it's going to be prescribed alongside all other treatments, a standardised part of care. So when you're prescribed your chemotherapy, your radiotherapy, immunotherapy, hormone therapy, you will be prescribed an exercise regime alongside that, which I think is absolutely incredible. When that might sift through to other parts of the world, we don't know. Who here was told or encouraged by their nursing team or their medical team to exercise during treatment, post?
Have you?
So a few hands. That's not bad. Sometimes I get one.
I was actually positively discouraged in 2011 when I was first diagnosed.
Wow. All right. So 2011. Yeah. We were still slightly in the.
I thought I was silly because I was trying to do yoga exercises from YouTube.
Okay.
25 minutes a day.
And discouraged because you needed just to rest. Yeah. Okay. All right. So that was obviously certainly how. Certainly when I was nursing, I have to say, all those years ago, I didn't run around telling all my patients to go and exercise. We were telling our patients to, you know, to rest, put your feet up. But we know when we put our feet up, fatigue, which is the most cited symptom throughout treatment and beyond, will get worse. It will get worse, and you're kind of stuck on that deteriorating kind of hamster wheel, really, of tiredness, rest, more tired, and then lack of ability to get up and move. But yeah.
Interestingly, by the recurrence in mid-2013...
Things had shifted. Amazing. So in that 2 years, and thankfully since 2013 and now, I think there has been quite a shift. But I am still really surprised just how little I think patients are encouraged to exercise. I think sometimes what is very, very difficult is knowing, certainly for healthcare professionals, is knowing what to do, how much, what kind of modality. Do I lift weights? Do I do cardio? You know, and that is still a slightly grey area in terms of what to do for certain types of cancer, certain types of diagnosis and stage. But what I think the message that is absolutely out there now is we do have to exercise regardless. And it could just be 5 minutes. 5 minutes round the living room, round the garden, on the hour. Do it again the next hour, do it again the next hour. Who here exercises, time for confessions, on a regular basis? Oh, you're amazing, you're amazing. All right, brilliant. All right. It doesn't matter if you kind of hide behind your hands there. What I hope to do is just maybe inspire and motivate a little bit today by sprinkling a few kind of little seeds that then make you go away and think, okay, what can I do to maybe be a little bit more active? Whether that's putting an alert on your phone to walk every hour for 5 minutes, 10 minutes, or do some sit to stand exercises, or do some stretching. All these things count, they all matter. And sometimes it's, you know, the thought of going out and getting sweaty and horrible isn't nice. So it might be that you begin by just breathing. Okay, who here does breathing exercises? Oh my God, you're brilliant, you lot. Excellent. Thank God. I know we're all breathing here, but actually conscious, connected breath work, really important. We need that to move our lymphatic system. It's part of our immune system, all right? So the breath is not, you know, the moves your lymph. It won't move any other way. Movement and breath. So who here needs their lymphatic system to be healthy and to be powerful and strong and mop up rubbish, mop up toxins? Me too. We all do, okay? We all do. It won't get moved by the heart, okay? The heart pumps the blood, doesn't pump the lymph. It needs to be moved by deep conscious breath work and exercise, a bit of skeletal muscle work. And it doesn't need to be vigorous. So that's one good thing about the lymph, is it doesn't need to be vigorous, all right? But again, we still need our blood to pump. We need our heart, our lungs to be strong, okay? So it is medicine. This is a fantastic link. I'll send my slides to whoever, or you want to take a screenshot of it. It's a trial that's currently going on in Australia. I think it's nearly towards the end, looking at administering exercise to people in treatment. So they go for their chemotherapy, their radiotherapy, they come out, quick cup of tea, straight in the gym. Yeah, I know, I know. Even when I did all my training, there was a kind of allow people 48 hours around their treatment to not exercise. No, I don't even do that with the people I work with now. So even on days of treatment, pre-treatment, post-treatment, something gentle, but I keep them moving. I keep them moving. So this is a great, it was put out by a news team in Australia, and it'll give you a flavour, a sense of what this trial is all about. And the evidence, well, certainly the data coming out already from patients is they're getting through treatment better, quicker, fewer side effects, feeling stronger physically, but also up here. Who here does exercise for here? Yeah, me too. Sometimes more than my body. I was watching a great TED talk this morning on the power of exercise and protecting our brains. So not just our body, but how important it is for our brain, all right? It improves our hippocampus, it improves our frontal lobe. So we're providing a protective layer, not just for our body, resilience for our body, but resilience for our brains, okay? And I need that. I know my memory is getting rubbish. I know I can't find things, remember things. And actually exercise will help with all of those things. So we need to see it as medicine for the whole body, all right? So improving our inner terrain. Who hears that word? It's quite a buzzword at the moment. So improving the inner terrain of our bodies, looking at how we can get everything working really well. And the lovely thing about this medicine, no side effects. No side effects. So I've got one of my family members at the moment's just sadly had to start a lot of drugs. The side effects are awful, awful. They're not actually doing the thing that they need to do. They're making things a lot worse. And unfortunately, that is a consequence of most drug interventions. Exercise, unless you suddenly go from couch potato to doing 50 star jumps a day, and you might pull a tendon or rip a muscle, you'll rarely get any side effects, providing it's dosed accordingly. It's like medicine. You dose your exercise according to your symptoms, your side effects, your level of fitness, your ability, fun factor. Don't do something you hate. So that's really important. Find something you really like. Could be dancing around the living room. I don't know, Zumba, couldn't think of anything worse. But, you know, finding something you like is also very important. And when we do something we really like, what happens to the medicine? It works better in our bodies. So it'll kind of start to seep inside and actually do some real good inside as well. So you're getting the happy hormones as well, and we all need those. So there we go. So as I said, sometimes for many people, exercise is that. I don't want you to think like that. I want you to, well, you can do if you like to run on a treadmill. I couldn't think of anything worse, but I want you to think about movement, physical activity, movement, exercise, whatever word works best for you to try and get you to move that little bit more. Anyone use a Fitbit or a pedometer or an app on their phone? Yeah, they're great little incentivizers, good motivators. I always say, don't worry about the 10,000 steps, aim to get there, but don't just see that as an absolute focus. Bring up your default setting. So if you're walking, my step count this week has been shocking. I don't think I've gone beyond 3,000 on any day because I've been at work and tapping away and seeing patients. And I really notice when I don't walk that much. And actually walking is the best thing we can do. It's so amazing. And when you look at studies around the world, populations where they don't drive, they live long, they are better, they have healthier bodies and they live longer. And it really is just because they don't get in the car and they're out and they're walking a lot. So Japan is one of them, definitely. Right, okay. Any questions so far? So, quick recap of side effects. Obviously, I don't know any of you. Some of these may resonate with you, some of them might not. And I might have some that are missing here. So again, exercise can really help with all of these things, providing it is titrated accordingly. And that you build up nice and slow. So if anyone here, is anyone here still experiencing quite extreme side effects from treatment? Yeah, so does anyone want to share any with me?
She myself got side effects from the steroids.
Yeah, okay. Okay.
But I used to exercise a lot before I was diagnosed, but I've had no advice since.
Okay.
I've kind of stopped other than walking.
Yeah. I can give you some advice. That will certainly help with that one. Steroids, quite an interesting one because sometimes people get that lovely steroid high and they kind of think, I can do anything. I can go and climb a big mountain. And yeah, it's a bit like fake news. It's a bit of a fake high. So just being very, very careful around steroid days that you don't just think, I'll go hell for leather and do everything. So again, it's just titrating it around any issues. Restricted movement, pain, lymphedema. We know exercise now is really important if you are at risk of or if you have lymphedema. But again, making sure that you've got the right guidance and the right advice there. Stomas. So I don't know if anybody here has a... Yes, of course. Right.
And one of the side effects is lymphedema.
Right.
So I've just been told to put my feet up.
Ah, okay. Forever? Just put your feet up? I love that. Okay, was that lower limb? So is it the risk for you?
More on the left leg.
Right, yeah.
And sometimes I can hardly walk because
Yeah.
the ankle is swollen.
Right.
And is there any exercise I can do?
Yeah, absolutely. I mean, popping your feet up to kind of really help drain. So lymphedema is where lymphatic fluid collects and you get this swelling. And unfortunately, sometimes it's very difficult for it to go back down again because the molecules are quite big. But so yes, popping your feet up to allow a little bit of drainage, you're allowing gravity there. So yeah, that's great. But obviously not ideal to just pop your feet up all the time. So yeah, so lots of ankle mobilization. Your ankle is like a pump for the lower limb. So legs up and lots of ankle mobilization, toe flexion and extension, lots of pointing and flexing, lots of getting your calf muscles moving. But again, I can help you with that. I can send you some ideas and tips to get moving. Lots of abdominal breathing to try and get that lymph up from your lower body up towards the torso. Lying in bed, bicycling your legs as if you're an imaginary bicycle. Yeah, all from the comfort of your own bed, all right? Because at the end of the day, it needs gravity, all right? So our lymphatic system moves from our peripherals to our heart. So it has a really hard job. No blood, no heart to pump it, and it's got to get from here to our heart, from our toes upwards. So it has a really uphill struggle. So anything you can do to allow gravity to drain, to pull down, even just popping your legs up on a stack of pillows and lots of ankle mobilization, flexing through the calf muscles, things to try and help. Also, you can do other things. Skin brushing, dry skin brushing, arms, legs, torso. There's lots of little tips that I can give you that is hopefully a little bit better than just legs up. All right, but I'll be happy to share that with you. Yeah.
Hernia.
Hernia for abdominal.
Yes.
Yeah. Is that in relation to a stoma?
Yeah, post-surgery.
Yeah, so I've just been, well, I'm still involved in it actually. I've been involved with a trial with UCH and Bowel Cancer UK looking at stomas and at the feasibility of exercise. And I don't want it to go over into the session, but I can certainly talk to you about that, absolutely, because we've been working with many patients in the last 18 months looking at preventing hernias, but making people strong. All right, so again, lots of exercise, lots of things that you can do there to make yourself strong. It isn't absolutely don't do anything. Certain things to avoid, definitely, to be safe, but actually there's a whole lot of stuff you can do there. And I can send you a link to a great video as well for that, no problem. So peripheral neuropathy, absolutely lots of little tips and things if you've got anything going on with your hands and feet. Again, just making sure you're safe. All of these things about making sure that you're safe. Does anybody know, oh, this is a good one, so bone thinning. Anyone here that's got any problems with their bones? Yeah. So we need to keep our bones healthy. We need to keep them strong, particularly if they are becoming quite fragile. And again, exercise, movement, it's the best thing we can do for trying to hang on, to hold on to our bone mineral density. Again, having to be careful if you've got areas of fragility, making sure that you're safe, but actually exercise is one of the best things that you can do to try and maintain that. Joint pain, I mean, honestly, there are ways and means of getting around this, but generally exercise, providing it's prescribed properly, shouldn't cause you any exacerbation of these symptoms. Has anyone here taken on anything new? Been inspired to try something new with regards to exercise? No? Oh, okay, well maybe, yes. Power loo. Oh, power hoop. So is that with a big hoop? Fantastic. They're weighted. Amazing. It sounds quite difficult. Is it difficult? Is it all right? I imagine you've got a great core. You're heading in that direction. Brilliant. I mean, I think that's the lovely thing is that these days, exercise, it's quite a... Oh, I've gone back. There we go. There's so much out there now. There's so much variety that you can kind of see, I've never even heard of this thing, a weighted big hoop thing. There's just so much you can do. Obviously you can go and walk the dog and swim and things like that, but actually there's just so many different classes, there's so many different things. There's trampolining classes where you go and work out with music. I mean, there's just dozens and dozens of things. But that's not to say you have to do that. You can absolutely just stick to your walking or your cycling or anything like that. And enlist the support of friends and family. That is really, really important because we all know sometimes it's very, very difficult to get the enthusiasm, the motivation to go out and do something. So I sometimes, particularly in the winter, I'll find anything to do than go out. I'll unload the dishwasher, which I hate doing. I'll put the washing on, I'll do anything. And don't worry, that all kinds of counts. Housework does count. But actually, it is really difficult sometimes to get going. But who here knows that when they've gone and done something, even if it's a walk around the block, do you come back and go, God, I wish I'd never done that. Wish I'd never. Never. Even if you go out and you're kind of cold and a little bit grumpy, you always come back and think, I feel a bit better. I feel a bit better in my body, and I feel a bit better in my headspace. Maybe you can think a little bit clearer. Your joints just feel a bit better. You don't feel quite so stiff. And, I think it's just reminding yourself of that. So even if it means you stick a note on your fridge door saying, go for a walk because you know you're going to feel better when you come back, all right? Or, just reminding you that you will get that slightly good feel-good factor, all right? And don't forget all the benefits that come with it. Stronger heart, stronger lungs, stronger bones. Better digestive system, better neuromuscular pathways, better head clarity, improving your mood, lowering anxiety. And again, you can do your heart pumping exercises, but you can do your kind of more your yin practice as well. So you've got your yang and your yin. Your yang is your kind of going out there and really kind of working quite hard. But then don't forget that the yin, the kind of more gentle exercise, equally important. If all we do is go hell for leather, it's not great either, all right? So sometimes I see people who I run 10 miles a day, every day. I'm like, whoa, that's not great either. That will create oxidative stress in the body, which is not great. That means that we've got just the body being flooded with too many hormones. Hormones that we need, but you don't want them too crazy. So this nice balance, again, that inner terrain, making sure that hormone levels are good. Okay, so you've got your good hormones going on, but we don't want too much of them. So it is really important that you kind of rest when you need to rest, and then move your body a little bit more when you need to move your body a little bit more. And I work very, very holistically like that, because I think if all you're doing is pounding all the time, you know, everything else is getting a little bit ignored, all right? So I think a healthy balance of everything is really, really important. They always say that, don't they? Moderation. So a little bit of everything. Right, okay, so we've talked about that. Any questions?
Finding a new normal.
Finding a new normal, yes, yeah. Have I gone back? Do I need to? Yeah, finding a new normal. Absolutely. Hi, yes. Yes, go.
What's the picture with bone building and bone density once? Is it fixed? Do you think of diet as it for a child, building with, say, with calcium, with milk or all those things? Once you are older and have the bones that you have, and exercise is good, is there a magic?
Exercise for me is the magic. I mean, there's certain medications that you might be given if your bones are thinning or you're at risk of quite depleted bones. But really, I mean, I think exercise is probably one of the best things. What you need to do is a bit of impact. So things like swimming, fabulous. Love swimming, one of my favourite things, but you're not going to build bone. Okay, you're not going to hang on to your bone structure. You need something where there's a bit of tap, a bit of shock against the bone. So resistance training, and I don't mean that you've got to lift huge heavy weights. You can just use your body weight. But walking is great, but we kind of need a little bit more impact. So walking down off a step, up a step, those kind of things where you're kind of just loading the bone in a different way. And what you want to do is have a tug. You want the muscles to tug against the bone, and that's what can help to stimulate and promote bone growth. All right, so adding all those things in are really important, but what you want is the tug of the muscles against the bone and a little bit of shock. So even just a little bit of kind of jumping up and down, providing obviously that you're kind of safe to do that. In fact, there's been some great studies carried out again in Australia recently looking at the prostate population and hanging on to bone mineral density, and they said that really it was a combination of cardiovascular exercise, so heart and lung, resistance exercise, so using some weights or using your body as resistance, and a little bit of impact loading. All right, so they had all these elderly gents doing unbelievable things. I mean, it was just quite extraordinary to see. There were men just hopping and jumping and doing all kinds of things. And when they went and had all their scans, their bone scans, the results were phenomenal. And that was very much based on exercise.
I'm not aware that I have such a problem, but it wouldn't be surprising.
Yeah.
I love to do my garden, that's my thing.
Yeah.
That kind of thing. And I have started racquetball.
Okay. Yeah. Brilliant.
I'd love to ride a bike, but I'm terrified to do that because of
balance.
My
falling.
Balance is not good, that's another thing, but fall off the bike, which would inevitably happen.
Perhaps, yeah, absolutely. Begin with some balance exercises. Who here does balance training? Yeah. Yeah, it's the most neglected thing that in exercise. If you go into a gym, you'll rarely see any trainers doing balance training. Yoga, yes, lots of balance work in yoga, but actually just standing on one leg, making some leg circles. You can do that while you're making a cup of tea. You can do that while you're brushing your teeth. You know, these are things that you don't need to go, right, I need an hour to do balance training. No, you don't. These are little magic bullets that you can literally drop into your day just while you're waiting for the kettle to boil, rather than doing that or doing that. Yeah? Or if you're doing that, stand on one leg. Yeah? So it really is, that, you know, obviously not walking down the street or anything like that, but there are loads of little sneaky ways that we can just feed exercise into our lives so that we're moving a bit more. You know, I've got so many of my patients now, it's great. You know, they're in their workspaces, their open plan office spaces, and they'll just do some stretches, or they'll stand up and start doing some sit to stand, you know, and then they've suddenly kind of got everyone else on board because they're like, oh, you know, what's she doing over there? And then suddenly everyone's kind of, and it is just about changing mentality a little bit. And then you start to feel slightly less stiff and a little bit more energized. And so just dipping those dropping those little things in throughout your day. So balance training, great. If you felt a bit stronger on your legs, you might feel a little bit more confident to perhaps try that bike at some point. And also it's about core strength as well.
Another thing that I find difficult, I had ovarian cancer 15 years ago, so a long time ago. But one thing that remains with me, it's balance associated. Say you have a washing line.
Yeah.
Just the reaching up and wobbling about.
And that's why we need to stretch. So I always say, so everybody, please don't move your plates or your cups down. You keep them up on the top shelf and you reach. You reach, you stretch. Keep your saucepans down there, so you still need to bend and get them, all right? Because that's what we tend to do. And we don't just do it like that. We do it just very subtly throughout our lives. Suddenly we're not bending down and getting things off the floor. We're just kind of, you know, because we just start to limit the way we move, and then that kind of trickles over time, and then suddenly, you know, I can't reach because that's the range of movement I've got in my shoulder rather than there, you know. And obviously there are restrictions because there's scar, you know, maybe scar tissue, or there's pain or discomfort. But, you know, stretching, balance and stretching, so important. And they are the two most neglected bits. And again, you don't have to spend half an hour doing a stretching routine. You can do it in the shower in the morning. Warm water, feeling a bit hot, roll your shoulders, and then just walk your hands up the wall and stretch. You know, really, I use sticks in the kitchen. I get my broomstick and I just use it, and I just help to stretch my shoulders and my arms when I feel a little bit creaky. And I feel creaky. I get out of bed most mornings and I'm a bit creaky. I get up by the time I hit the bathroom. So, and just little simple things. You can, kitchen work surface, desk, stretch your hips, stretch your back. You know, there's lots of little things. And once you start doing it, once you build consistency and frequency, and those are the two most important things, consistency, frequency. Don't think too much about time, the level of time or the effort, unless you are already in consistency and frequency. But try to think about that, doing something regularly every day. Does anybody here know what the regular amounts of physical activity are by the Department of Health? Yeah, 30 minutes, 5 times a week. Not much. It's not, I mean, you know, it's really not that much, and I suspect you're all doing that already. You all came here today. You know, but it's just taking opportunities. And you don't have to do 30 minutes all in one go. You could break it down. 5 minutes, 5 minutes, 5 minutes. All right? It doesn't need to be all one big chunk. So again, it's just, you know, if you see a flight of stairs, take them. If you getting the bus home, get off the bus 2 stops earlier, or 1. All right, so once you start kind of, you know, you can drip feed little things in. If your schedules are very, very busy, I know sometimes you just think, actually, I've got no time in my day and I'm exhausted by the end of it. How can I do this? So again, it is little things. So take the flight of stairs. If you work in a building and the stairs are too many, then start by just doing 1 or 2 flights, grabbing the lift and going up the next lot. So it's kind of just creating strategies that are palatable and doable for you as an individual, because no size fits all. Everybody is different. We've all got different bodies. We've all got very different musculoskeletal problems and builds and shapes. We've all got different likes and dislikes, and we've all got different issues, either from treatment or even just other injuries. So I've got loads of injuries. So, you know, it's not just about maybe sports being restricted and limited from the cancer and the treatment, but maybe old shoulder injuries or hip injuries, or even kind of, you know, childhood injuries that we pick up as well. Yes.
Can I just ask also about bone pain?
Yes.
And really bone pain because of taking letrozole.
Ah, okay, yeah.
I mean, I get it, particularly in the feet,
Yeah.
but I actually just try to work through it.
Yeah.
And just in my exercise regime, just
Yeah.
get on with it.
Yeah.
and I'm not sure whether I'm doing
No,
more
just-
damage or less damage.
No, it's a really good question. It was a really good comment, actually, because I think when it comes to pain, again, it's very subjective, and I think it is just knowing, and I think you've probably done the right thing, actually, kind of knowing I can work through this, right? This isn't agony, this is okay. We know when we kind of get pains that there's a little bit of a red flag, there's an alarm bell that's going off, and I think if those occur, then absolutely stop, get it investigated, get it explored, and then rethink. But yes, with certain things, it's like a stretch, it's like a deep stretch. You know, I'll say to people, I want you to feel a good deep stretch, but not a sharp, bracing pain. And I think joint pain, bone pain from things like letrozole, just gently working through it. All right. Do you find that it eases once you've got up and moving?
Sometimes, but not always.
Not always. Yeah. There is no kind of magic bullet, but what I tend to say is just smaller bouts of exercise more regularly, so that you're kind of making sure that you've got good blood flow.
I find it for swimming, so it's
That kind of slightly less impact. Yeah.
And you can actually work and you get through it.
Absolutely.
Walking 5
Yeah.
miles or something like that.
It can get a bit sore, yeah. So again, it's just titrating it as well according to maybe what days, your days, whether it's kind of if it's a tough day, swim. If you feel it's a little bit better, then maybe you can do your walking. But yeah, I'm afraid it's just kind of gauging it in terms of your symptoms, really. Also, I really suggest keep a diary, track things. It is a good way of tracking it. So whether you've got fatigue, pain, anything like that, it's a good way if you're exercising just to keep a note and track. And you don't need to write loads of stuff. So just say, good day, no symptoms, felt great, blah, blah, blah. And just put down what you've done, because it's quite a good way to look back and go, oh, actually, that really exacerbated it. So maybe I need to just par down on that a little bit. That works really well with it. And it is a good way, because I'm a terrible historian. I can't remember what I did yesterday. And then you start to kind of build a pattern, and particularly if you're in the treatment phase still, you can see perhaps where the good days are and the quieter, more kind of fatigued the days are. Right, so we've talked about that. As you can see, I'm not very good at sticking with slides. I tend to just talk. Right, so there's the guidelines. Avoid being sedentary, absolutely. Oops, there we go. Be active every day, and my thing is, as I've said, move more often. So just little bits. They go a long way. If we bank all those 5 minutes, it's amazing. It's amazing what good they do. 150 minutes, if not a bit more, that would be great. The thing, particularly within oncology, within the cancer population, the one thing that no one really gets encouraged to do or told to do is resistance training, strength training. Who here does strength training? Whether you're using your body weight or lifting weights or using TheraBands? Anyone? So there's a few of you. Brilliant. And yoga strength training, Pilates, that's all strength training. That's the thing that I think, and if I look at even just my peer group, my friends, my husband, no strength training. No one does any strength training. And that is the thing that is super, super, super important. We must build muscle. We must build muscle. And what a lot of the research is now proving is that when we build muscle, it has anti-cancer properties. They are looking at blood serum taken from people who are strength training. And so far, it's very small trials at the moment, but the results are really showing incredibly positive things. There's something that happens in our muscles when we build muscle, when we use them, that we release a kind of an abundance of natural killer cells. So it creates this really healthy kind of like almost like a protective layer in the body. And it's the one thing that we just don't do as we get older either. We just don't build up muscle. And muscle is, it's super, super important for the body. It's metabolic. So it's essential. It's essential. And unfortunately, every decade, our muscle mass and our bone mass just waves goodbye. It disappears, and it's harder and harder and harder to hang on to it. So I urge you to try and do some strength training activities 2 to 3 times a week, okay? And that might just be some chair squats. Brilliant. brilliant exercise, okay? You might do some heel raises, okay? You're using your calves, you're using the muscles in your feet, all right? You might just do some standing leg lifts, okay? You might just do some, a few lunges, something where you're putting a strain on your muscles and you're making them work. If you've got weights at home, fantastic. TheraBands, those stretchy bands? Brilliant. They don't take up any room. Just don't put them under the bed and hide them. Different resistance, so you can start low and build up, all right? And again, start using, so you can put them around the banister, pull, use the muscles in your arms, use the muscles in your shoulders. So, that's the thing that really is super neglected. So 2 to 3 sessions ideally, maybe just begin with one. Yeah.
Can I just ask, are you saying this for anyone at any stage, whatever their treatments?
Absolutely, yeah, absolutely. Obviously, it needs to be tailored around energy levels, any kind of limitations, any other side effects, any other complications in the body, definitely. But yes.
And post-surgery?
Yeah, absolutely. I mean, again, you need to allow yourself post-surgery time to heal. But no, absolutely, strength training. Yeah, very much so. Yes.
Any research to when you...
I'll come back.
Sorry.
Sorry.
As you're getting older,
Yeah.
So I'm 33, I was diagnosed at 65, recurrence at 67.
Yeah.
I've worked really hard since, but I feel I've peaked and I don't feel my strength and stamina is getting any more.
Right, okay.
Whatever I do.
Okay.
And somebody said, well, why should it? You're getting older. And I thought,
Oh, I don't know. I've worked with some older people and they've really...
So I just keep going.
I think just keep going. Maybe go on, if you're going to classes, maybe push yourself and go to a bit of a tougher class. I can certainly give you some support and some guidance on that. But no, absolutely. I've seen many much older men and women go in with very little, and then they start to build muscle mass. Now listen, it doesn't happen overnight, all right? I think that's the other thing about exercise is people often want results really quickly and it does take time. And if you've been relatively inactive, it does take a little bit of time to perhaps build up the kind of real strong feeling that you want. But actually, what I've really noticed in the work I do is that the people that I work with who really are inactive and do very, very, very little, they actually start to make really good gains very, very quickly. It's incredible, it really is. And you get this kind of, wow, and then it might slow down a little bit. But actually the gains are often coming from kind of right down at the bottom. But no, I don't think you've plateaued. I think there's definitely room and there's scope for you feeling stronger and fitter. You might have plateaued on what you're doing now. So maybe you just need a bit of diversity. You need to move your muscles in a slightly different way. Or maybe just kind of isolate other muscle groups. But no, absolutely. Got lots in the bank. Right, okay, how are we doing on time? Oh, gosh, it always goes so fast. So, all right, so these are some of this might resonate with some of you. I was with someone just yesterday who was kind of stuck in there. My mind says go, my body says no, and vice versa. So one part of the body is saying, yeah, I want to do this, and the other part is saying, no, thank you. I don't know where to start or how to start. So I'm sure maybe at some point, the fear of exercising, I think, is often, very worrying, particularly if you're fresh out of treatment or fresh out of surgery. And really with that, the best thing is just start walking. And it might just be that you're walking around your house using your stairs. But, it's just about building that confidence between our heads and our bodies so that they're kind of as one, all right? And we haven't got one going off in one direction and one in the other.
What did you say to somebody? I remember when I was having chemotherapy, there were some days that I couldn't get out of bed.
Yep.
Never mind do anything else.
Yeah. So I'm working with quite a lot of people at the moment who are in the middle of chemotherapy, and they absolutely have those days. So on those days, I will give them breath work to do that they can do from the bed or the sofa. So that's actively using your respiratory system, and it actually kind of makes you feel like you're doing something as well, and it's flushing your lymph. I might give them some stretches to do, and it may be that I just say, just do the odd little walk for a minute, 2 minutes. because that makes all the difference. Even if it's just a minute, and it might just be, right, all I can do is get to the kitchen and back again, then I need to flop. Fine, that's what you do. Just try and do it a few times, just a few times. Absolutely, some of those days they just need to rest. But what happens is, what I've really noticed in my work is, if those kind of 3 or 4 days of feeling just like I can't do anything, if you do nothing, absolutely nothing, it's quite hard to then move on. So even just something every half hour or hour, whether it's breathing, stretching, a very gentle walk, all right, it just means that when you're ready, when you're out of that kind of those crummy days, you've got a little bit in the bank to kind of get you moving again. But I do hear you loud and clear. I know it's very difficult.
Can I just ask with yoga?
Yeah.
Is that something that would build muscle and everything together?
Yeah.
And when you've had a surgery or chemotherapy, how do you know, like, you know, unless you've got somebody who knows cancer, in terms of yoga, what you can and cannot do? I mean, do you have a guide or something?
Yeah, it is a little bit tricky. So obviously, if you've had lymph nodes removed, upper body, middle, lower body, there's some elements of risk, scar tissue surgery, anything like that. I mean, if you're starting something brand new, a new discipline, then I would always recommend that you start very, very beginner, very, very gentle. It is awkward, I understand, because not every kind of exercise professional knows.
Exactly.
Yeah, and I think that is where the fear can kick in and think, well, actually, they don't know my body, they don't know my treatment, they don't know what I've gone through, they don't know what long-term consequences I might have. So contact me. Use me as a resource. I'm also quite good at signposting people to other resources. I'm assuming you've all come from all over. Yeah. So sometimes I'll do a bit of legwork and I'll try and find some services for you locally where they might have people who can help direct and guide you. If you're worried about starting something because of those complications, or as we talked about, because of stoma and things like that, then come to me, ask me, and I can at least help clarify a few things. Because yeah, it is a worry. You go to a gym or a class and that person teaching knows nothing about. Yeah, absolutely, because they're there, you know, most of these people, professionals, are there to drive and push and push and push, and actually it's like, whoa. I mean, obviously there's quite a lot of cancer support centres around. I mean, we've got kind of places like Maggie's and things here in London. They offer lots of classes, and sometimes those can be great stepping stones to you getting confidence in your bodies again and kind of working out what feels right and what doesn't, to then you being able to join a mainstream fitness class or keep fit class or aerobics class or anything like that. So I understand there is that kind of period which can sometimes be a little bit daunting, because I know, you know, in kind of regular exercise environments, you know, it's like, oh, you know, feel the pain, feel the burn, and it's like, there's no need for that. There's no need for that. You can still get fit and you can still get strength and you can still feel amazing without feeling agonising pain and agonising burn, okay? You want to work your muscles, they want to feel a little bit sore, but yeah, there's no need to, you know, I mean, that's the kind of exercise philosophy, no pain, no gain, but I don't work like that, and the guys I work with do fantastically. Right, okay, I want to get everybody moving a little bit before we draw to a close. So, everyone's thinking, God, no. Right, so just a few things which I think I've really touched upon anyway. You know, better vitality, better sleep. So that's a big one. Who here doesn't sleep brilliantly? Me too. So I do know that, you know, if I can try and get myself out for a good walk, then I know I'll sleep a little bit better that evening. It will improve fatigue. It will enhance range of movements, guaranteed. So there's just so many benefits that go above and beyond treatment, really, and the cancer itself. And it's about, all of this will help to build, as I talked about, that kind of, it can be transformative. Someone said that to me yesterday when I was with him at home. He said to me, he's very, very weak, but he just said that for him exercise is transformative. And it was just such a beautiful word that I kind of stopped and I looked at him and I thought, yeah, you're right. It can be hugely transformative for your mind and for your body. And it doesn't need to be an hours long body pump class. It could just be that you get to the park and you push your children on the swings, or your grandchildren, or you know, you have a little run through the woods with you know, the kids, anything, and that can be transformative. And so I just loved that word yesterday, so I thought I'd share that with you today. And improved body image. We know when we feel a bit stronger, when we feel a bit fitter, we just feel a bit more, yeah. And it's really empowering. Exercise is one thing you can do. You can have the reins. You decide. You decide what you want to do, where you want to go, how you want to do it. Everything else, unfortunately, within the world of the medical world, and I was part of it for a long time, you're kind of told what to do. Have this, have that, do this, do that. Why haven't you done that? How no? Exercise is something you can control, and you can take hold of, and you can decide. And I think that's what's so wonderful about it. And prove to your medical team, I'm really great. No, I've got a young girl who's in for her second stem cell transplant this week. And on the last one, they said, oh, you'll have to be in for at least 4 to 6 weeks. She was home within 3. They kind of were like scratching their heads and going, go home. Don't quite know, you're weird, but go home. Because she was so well. She hadn't become really unwell and needed acute admission. She was just sitting in a hotel room and they said, go home. And she's looking the same for her second. She's doing brilliantly. She exercises. She exercised before, she got really strong. She's in that hotel room and she's doing her exercises and she's working out. She's got a lot of nausea. She feels really exhausted and fatigued, but she's doing what she can. So she's not weird, she's just amazing. She's amazing, and she's kind of, you know, she's driven because she wants to get home. She wants to be with her kids. She wants to be with her young children. She doesn't want to be stuck in a hotel room. So I email her most days and we FaceTime and kind of keep her going. And again, motivate, get people to motivate you, but motivate others as well. And I think that's what I've also learned, is a lot of the patients I've worked with, they've ended up motivating, you know, they're the ones that have been unwell and they've ended up getting their family members to do more exercise. And I just love that. I think that's absolutely brilliant, that they are the ones almost leading the way with their kids and their husbands and wives. So some of the challenges, do some of these resonate? Again, it's kind of work, time, family, social. Exercise can be social, can be sociable. Anybody here do the kind of like park walks on a Saturday morning? There was one in my park this morning. I saw them all going round. So it's like they're free. Most parks do them around the country now. The 5K, you don't need to run it, you can walk it. Doesn't matter. There used to, I think I live up in Ali Pali, and there used to be, oh God, like a little trickle of people going round on a Saturday morning. We have about 700 people now. And you hear them coming, it's like, and you're kind of looking and you're thinking, where are they all? And then they come out the trees, and it's amazing, all shapes and sizes, and it's just wonderful to see, actually. And everyone's kind of geeing everybody along. It's great, whether you're walking or kind of struggling. Right, so again, I've mentioned that one size does not fit all. It certainly doesn't. Facilitators and enablers, there we go. Don't put your pedometer on the dog, okay? Some of my clients have done that. They come in and they've done like 50,000 steps, and I'm like, wow, amazing. So yeah, there we go. That's one of the walks, the fit walks. Keeping a diary, keeping a workout. I know that seems really old-fashioned, doesn't it? Papers and pens, but that's how I work. Friends, buddies, if you've got someone coming to your doorstep, going, come on, we're going out, you're going to go, okay. Whereas if that person doesn't come and say, come on, go out, you're going to go, I'm not going out. So you won't let people down. I think that's what's really good. So if you've got someone coming to nag you, and lots of apps, lots of brilliant things now on smartphones. 10-minute workouts. It's great. 10-minute workout, 5-minute workout. So you can just download them and just follow this person and you do a few exercises. Modify it. If you look at that and you think, I can't do that, just modify it, customise it so that it works for you. So if you can't do a deep squat, just do a little one. Yeah, just bend your knees, take your hips back and do a small one. So you just modify it and customise it so that it works for you. It's a very cute dog, isn't it? Right, okay. Safety. The research I've talked about briefly, but if you want, I haven't got 13,000 studies, obviously, but if anybody here wants to read a bit of research, then do let me know. Right, I'm going to draw to a close because I do want to get you moving. Strengthening I've mentioned. Start low, build up slow. all right? And if you want any guidance and advice on that, then do come to me. When we're stronger, it will make functional daily tasks better. So if you do suddenly think, God, I'm really struggling to lug the washing, hang the washing out, build our muscles, and that won't feel quite so difficult. Because we know that just daily functional activities of living are quite repetitive. They're quite hard, they're quite difficult. So when we build strength, that'll feel a bit easier. Right, okay, let's get everybody up. So there's my top tips. If anybody wants my slides, you can have my slides.